Good day and welcome back. I am Dr. Scott, your online headache doc, the only doctor of any kind certified by both the American and International Boards of Commonsensical Medicine. Welcome to Relief at Last, what your doctor won't tell you about your migraines, your headaches, and your pain. Today's question of the day. I've been told that my migraines are a neurological disorder and that there really isn't a long-term solution. Is this true? Well, if you look in the wrong place, you'll never find what you're looking for, and that is the real, true cause of your migraine and headache symptoms. In my book, Migraines and Headaches, Simple Steps to Proven Long-Lasting Relief Despite Your Doctor's Recommendations, we discuss whether or not migraines are actually a neurological disorder, or are you having neurological symptoms as the result of another underlying issue? And this is what decades upon decades of medical research continues to show. So what I'm telling you is your migraines, your headaches, may not even be a head problem. So neurological disorders, multiple sclerosis, ALS, there are many serious neurological disorders. There are neurological emergencies, bleeding in the brain, brain tumors. These comprise a very tiny fraction of the cases that we see in our day-to-day practice. As a matter of fact, in my 31 and a half years in private practice so far, we have had exactly 3 of these cases. And the symptoms with which my patients present when they have a true neurological disorder are very distinct. So, why is it that if migraines are classified as a neurological disorder, does all of the neurological testing seem to come back, quote unquote, normal or unremarkable? In medicine today, if your primary care doctor, who will usually treat with prescriptions for your migraines, is unable to help you, you are usually referred to a, you know it, neurologist. Yet, when all of the neurological tests are performed, they're usually unremarkable. And if imaging studies are performed, maybe that's a CAT scan of your head and MRI of your brain, the vast majority, probably most all of the time, the findings once again are unremarkable. So how is it that in medicine today we can classify migraines as a neurological disorder, yet there are no positive neurological findings? Now, in day-to-day practice, we perform a neurological screening test on all of our migraine and headache patients. What I tell my patients is, nobody, in this case, you never want to be that 1 in a million case, and we will never gamble or guess with your health. So, neurological screening tests, cardiovascular screening tests are performed with each of our patients at the time of their initial evaluation. But when neurological testing is all unremarkable, where do you go from there? So, the simple answer to the question today is, according to decades upon decades of proven, published medical research, the chances are better than not that your migraines are not a neurological disorder, but rather, listen to this, a neuromusculoskeletal disorder. Now, neuromusculoskeletal is a big word that simply means this. You are having neurological type symptoms, whether that's migraine type headaches, dizziness, vertigo, feeling sick to your stomach, vomiting, lightheadedness, brain fog. All of those are neurological type symptoms that result from a structural disorder in the upper part of your spine that compresses the spinal canal. In my office, we call these spinal compression or spinal canal compression migraines. And no, this is not an opinion. This is based on decades upon decades of proven, published medical research that all of our doctors have access to. So then, why, if this has been published hundreds and hundreds of times in the medical research dating back to the 1950s, why is it that our doctors either, number one, don't know about this research, or number two, quite simply just ignore this medical research? Well, we've talked time and time again about how our medical system is structured. Each doctor, therapist, chiropractor, physical therapist, each type of healthcare provider is fitted with their specialty goggles when they graduate from, quote-unquote, doctor school, which means each practitioner and each specialist is only trained to evaluate your migraines from their limited scope of practice, and when treatment is prescribed, the treatment that you'll likely receive just so happens to be the type of treatment it is that they are trained to provide. Now, rarely is there simply just one type of treatment alone that's going to address the real cause of your migraine and headache symptoms. This is the problem. So, most of us, this includes me for many, many years battling debilitating migraines, we end up on the medical merry-go-round. We try this and try that and try this and try that. We go to this doctor, that doctor, that. You can try things out. There are countless ways to treat or to attempt to manage your migraine symptoms, all the while continuing to ignore the real, true cause. Let me say that one more time. This is the summary and what I want you to take with you today. There are countless ways to treat your symptoms, all the while ignoring the cause. If you don't focus first and foremost on pinpointing the real true cause of your migraine symptoms, and instead you focus on trying things out, trying the next best new and improved pill, shot, potion, gadget, gizmo, chiropractic treatment, therapy, vitamin supplement, herbal. You can try things out. By the way, some may even provide a bit of temporary relief. However, there is absolutely no pill, there is no magic pill that will address the cause of your migraines once and for all. It doesn't exist, it hasn't existed, and it never will exist. Look, pumping our bodies full of foreign chemical drugs day after day, week after week, month after month, and yes, sadly, year after year, does not address the cause of your migraines or headaches. So, in summary today, migraines, are they really a neurological disorder? Likely not. The more likely scenario, according to decades upon decades of proven published research, is they are a neuromusculoskeletal disorder, which means a specific structural disorder with the normal shape, structure of your upper spine compressing the upper part of your spine and spinal canal, resulting in neurological symptoms. This is what decades upon decades of research supports. Do not ignore the proven research. Finally, we've said time and time again, I say this day in and day out, professional opinions are simply that, opinions. And opinions vary greatly, and even amongst our healthcare providers, much of the time these opinions conflict. So please, I implore you, please do not make the important decisions about your health care or about the health of those you care about based on more and more differing and conflicting opinions. Make these important decisions based upon proven medical research. This is the reason that we've been so successful and helped thousands just like you since early 1993. Now, it's your turn. It is time for you to experience relief at last. I'm Dr. Scott, your online headache doc, and those are the facts. And everything else, well, it's just another differing opinion. The information contained in this podcast is for informational purposes only and is not meant to substitute for your doctor or healthcare provider's advice or recommendations. It is based on Dr. Scott's personal experience battling debilitating migraines for years, as well as his more than 31 years in private practice, specializing exclusively in migraine, headache, and chronic pain disorders. Copyright 2024 by Milagros Media LLC.